Hey guys, my name is Kay McDonald and I'm a master's level athletic training student at Texas Lutheran University, and I'm here to talk to you today about an article that I found over muscle reaction time during a simulated lateral ankle sprain after wet ice application or cold water immersion. I left the citation at the very bottom of the screen in case y'all would like to go out and find this article and look more into it. So the methods that they used for this was a randomized controlled trial. So basically what that means is that they would split the participants up into groups, 3 groups specifically, and then give each one a different treatment, which is the independent variable. So the types of treatments that they would give would be, for group 1 is the wet ice application. Group 2 would be the cold water immersion, and then group 3 would be no treatment at all. And then they would look at the dependent variable, which was the muscle reaction time and the amplitude of the muscle itself. So for their participants, there was a total of 58, 30 men and 28 women, and all of them ranged between the ages of 18 and 25. In order to be included into this study, the athlete or the patient would have to participate in a sporting event at least 1 time per week. They would have to have pain-free palpation over the anterior talofibular ligament and the calcaneofibular ligament, and then also have pain-free active range of motion of the ankle, which includes plantar flexion, dorsiflexion, inversion, as well as eversion. The exclusion criteria for this study was previous history of ankle sprains, an injury during the time of the study, or an injury that would biomechanically affect the motions of the lower extremity, lower limb surgery, an intolerance of ice or the cold, and the use of orthos. So for the instruments, it was basically ice, water, and a cool box, and then the cloth bag as well for the wet ice application. So for the data processing and results, the EMG machine was used in order to measure the activity of the muscles during and after the treatment, whether it was the wet ice application or the cold water immersion or no treatment at all. And they would also measure the amplitude of the muscle. And then the results was that the reaction time of the muscles were not affected no matter what treatment was given. So in conclusion, the cooling of the joint did not affect the muscle reaction time. Athletes and patients can return to play immediately after icing, and ice does not adversely affect the dynamic control of the muscles itself. So from a clinical application standpoint, I myself would apply the wet ice or cold water immersion before rehab, practice, games, or any kind of activity for the athlete, if that will help reduce the pain and obviously not affect the muscle reaction time and cause further injury. And then I would also use it throughout practices and games, like for cramps or anything like that, just to help with the pain and return to play. So the one critique that I had was to do a study on actual anterior talofibular ligament sprains, because this one was like a simulated sprain. And then for future studies, I would like to see how ice and cold water immersion would affect other joints. That is all I have for you today, so thank you for watching.